A pleasant good morning, Trinidad and Tobago, and welcome to the Ministry of Health's update on the national COVID-19 response for Wednesday, 3rd August 2022. Our panelists for this morning's update are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Miriam Richards, Principal Medical Officer, Institutions. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's update. We begin this morning's media conference with Dr. Parasram, who will provide the latest COVID-19 update, followed by information on the monkeypox virus.
Hi, good morning. Thank you, Mr. Alexander. Good morning to the Honorable Minister. Good morning to Dr. Richards, members of the media, members of the viewing and listening public. If I could have the dashboard for 2nd of August 2022. Update number 1,169. Population vaccination status remains at 51.1%. In terms of our new positive cases, over the last 24 hours, we would have reported 89 positive cases. Our 7-day rolling average is now standing at 174. Our deaths reported during that period, 1, and condolences to the family of that individual. The 7-day rolling average for deaths also stand at 1, and the case fatality rate stands at 2.36. In terms of our total active positive cases, 6,145. Hospital patients, 159. And those vaccinated, again, 80% of those are unvaccinated who are in the hospital or have been in the hospital from July 22nd, 2021 until 27th of July 2022. And similar trends, upwards of 90% of those who have passed away as a result of COVID have been unvaccinated as well. Total deaths now stand at 4,054. As it relates to the hospital breakdown, as of yesterday, 159 persons in all institutions, 60 persons in the Couva Hospital and Multi-Training Facility, 3 in ICU, 7 in the High Dependency Unit, 39 at Cora, Augustus Long 29, at the Arima General Hospital 12 persons, and at Scarborough Regional Hospital, Fort King George 19, and 1 at Signal Hill, Scarborough. In terms of the COVID-19 Omicron sublineages, the last week's report now show, of course, BA5 still the dominant variant in the country, dominant sublineage at 53.2% of the samples, and BA4 accounting for 26%. The remaining samples are BA1 and BA2. As regards to monkeypox, in terms of the brief update, we now have 21,064 cases globally, 78 countries having confirmed cases, 66% of the cases still in Europe, and 32% in the Americas. The lion's share of the Americas portion is in the United States of America, and we have noted states of emergencies being called in New York, California, and I believe the latest is now Illinois. So thank you, Mr. Alexander, for the few minutes this morning.
Thank you very much, CMO. We now go to Dr. Richards, who will provide the latest information on the parallel healthcare system. Dr. Richards, good morning.
Good morning, and thank you very much, Major Alexander. Good morning to the Honorable Minister and to the Chief Medical Officer, Dr. Parasram. And of course, good morning to all our local, regional, and international viewers. Thank you so much for your continued support, collaboration, and participation in our weekly press briefings. Of course, to our friends and colleagues in the media, thank you very much for continuing to join us over this 2.5-year period. This morning, I would like to pay some attention to numbers in the hospital to the parallel healthcare system. And as of this morning, there are It went off? Okay. Apologies. Yes, good morning, everyone. Thank you very much, Al. And good morning to the Honorable Minister and the Chief Medical Officer, Dr. Parasram. Good morning to all members of the media. Thank you very much for your continued support and collaboration and participation in our weekly media briefings. And good morning to Trinidad and Tobago, as well as our local, regional, and international viewers. Thank you once again for your support and, of course, for your patience as we had that technical glitch. This morning, I would like to share some information on the hospitals in the parallel healthcare system. And as of this morning, there are 156 patients in the parallel healthcare system, representing a national occupancy of 25%. Now, I'd like to share some trends that we would have noted. And we have noticed an uptick or an increase in the number of patients in the parallel healthcare system from the 28th of July 2022, when the number of patients exceeded 110. There was a general decline in the number of patients in the parallel healthcare system noted from February 18th, when the national occupancy reached or decreased to 40% and declined right down to the lowest percentage we saw when there were 87 patients at about 15%. However, over the last week, we have noticed an increase in the hospital admissions. And just for this purpose of trends, I'll just give you some dates. On the 13th of July 2022, we noticed the increase in the rolling average of confirmed cases. Then on the 23rd of July 2022, we noticed the accident and emergency admissions increasing. And of course, by the 28th of July 2022, the hospital occupancy began to increase. The Ministry of Health continues to keep a close eye and monitor the increase in hospital numbers in our hospitals, as well as our accident and emergency. I'd like to emphasize, however, that 80% of the patients that are hospitalized with COVID in the parallel healthcare system are not fully vaccinated. And this is a trend that we have noticed over the past year. We started analyzing that information on the 22nd of July 2021, and between the 22nd of July 2021 and the 27th of July 2022, 80% of patients, as shared on our media release, are not fully vaccinated. And this emphasizes the need for full vaccination, boosters in high-risk groups and where applicable. The number of patients in our accidents and emergencies, which really is a precursor and a way of identifying how many patients go into the parallel healthcare system, stands at 24 this morning. And as I indicated, we have noticed an increase in this area as well. In the ICU, there are 11 patients this morning across the ICU departments in Trinidad as well as Tobago. Ladies and gentlemen, the Ministry of Health continues to advocate and to encourage each and every one of you to become fully vaccinated to reduce your risk of hospitalization, your risk of being or requiring treatment in an intensive care unit or high dependency unit, and of course, your risk of transmitting COVID-19 to those who are vulnerable, such as young children who cannot be vaccinated and persons who are immunocompromised. Let us please continue to practice our social and personal responsibility by becoming vaccinated. And as I close today, I would just like to recognize and to continue to commend the selfless service by our frontline medical staff and all supporting services that have continued to diligently work and demonstrate resilience over the past 2.5 years. Thank you very much, Al, and I now hand over to you.
Thank you very much, Dr. Richards. We now go to the Honorable Minister of Health, who will provide us with the latest vaccination figures and address the current issues relating to the national COVID-19 vaccination campaign. Minister.
Thank you. Thank you very much, Al. Good morning to Dr. Parasram, Dr. Richards. Nice to have you back after a while, giving us an update on the parallel healthcare system. Good morning, ladies and gentlemen of the media. Hope you all are high and dry, and members of the public listening, good morning. So, yesterday, we would have done a total of 129 doses of COVID vaccines across the system. I just want to reiterate what Dr. Richards has been saying and what Dr. Parasram alluded to, that most of the people in our parallel healthcare system now, I think over 80%, Dr. Richards, are unvaccinated. So of the 156 odd persons, 120 of those persons are unvaccinated. And that is really a tragedy, seeing that we have vaccines which have proven to be safe and effective. So we continue to urge the unvaccinated to avail yourself of the vaccination program. The number of persons who have completed their vaccination schedule is 715,585. So the percentage more or less remains stagnant at 51.1%. Those persons who have been boosted, 167,380. And the total children, because we are still vaccinating that 5 to 11 age group, 2,885. I want to bring you up to date now on the issue of the acquisition of monkeypox vaccines and let you know where we are. So we would have alerted the national community last week, Thursday I believe, that we have placed an indicative order with PAHO for 2,000 doses of monkeypox vaccines. It's a 2-dose vaccine, just like the AstraZeneca or the Pfizer or the Sinopharm. So that means that could vaccinate potentially 1,000 persons. We have no firm date of arrival as yet. As soon as we have it, of course, we will let you know. We have no firm confirmation of pricing as yet, but we have placed an order, a very early order. Trinidad and Tobago was one of the first countries to place the order with PAHO for 2,000 doses of monkeypox vaccines. As far as testing is concerned, I would have indicated that we have local capacity for testing. I can now share with the national population that we have sent 8 samples for testing locally, 8 samples, and all samples have come back negative at this point in time. So we continue to be vigilant, we continue to monitor, and we will continue to test as far as we have these suspect cases. As I said, we have had 8 and all have come back negative so far, and we continue to urge persons on the monkeypox front to be vigilant, be aware of the mode of transmission, which is skin-to-skin contact, intimate skin-to-skin contact, also via the sharing of clothes or sleeping on the same bed. The virus can be transmitted from those surfaces, whether it's clothes, bedding, using the same towels. That type of contact is to be avoided. So we continue to be prepared. What is missing now is the vaccines. Testing is up and running, and we have done everything else that we could do as we prepare more and more for the arrival of the monkeypox virus on our shores. So that is where we are. And just to close off by saying, I want to add my voice again, as I have been, for small states like Trinidad and Tobago to be able to access monkeypox vaccines. It is quite sad to see, as a global community, we are making the same mistake as we made for COVID, where the larger, wealthier countries have hundreds of thousands of vaccines, and countries like ours have none. I note a report in the, I think it was the Trinidad Guardian last week, I believe, over the weekend, which states that Africa, which had 5 deaths on the African continent, did not have 1 dose of monkeypox vaccine. That type of inequity is not helping the situation. And again, at a recent CMO conference, which was about 2 weeks ago, when I was delivering my address, I asked each country, do you have a clear pathway for the acquisition of monkeypox vaccines? And the CMOs from every single territory, from the Bahamas down to Suriname, all said no. So I want to appeal again to countries that have hundreds of thousands of vaccines to share some of those vaccines sooner rather than later, so that as a global community we can manage this monkeypox outbreak, of which we have 21,064 cases in 78 countries, and engage in some serious risk mitigation. Thank you very much, Al, and I think we can do our questions and answers now with our colleagues in the media.
Thank you very much, Minister. And as we move into our question and answer segment, our media representatives are asked to state their name and the name of the media house that they represent. They would be invited to pose 2 brief questions in the first instance, and please identify the panelists to whom you wish to address each question. Time permitting, we will accommodate a second round of questions. We will take our first question from Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My 2 questions are for, well, whoever wants to take it. Firstly, Minister, do we have any other samples that are waiting to be tested for monkeypox? I know you spoke about the 8 that came back negative. Do we have any pending? And my second question is on the increase in hospitalizations. What are we attributing this to, and do we have any projections of where that is going right now? Thank you.
Okay, so first of all, welcome back from your vacation, Rashad. We missed you. So, no, we don't have any other samples waiting for results at this point in time. And on the second question, we continue to monitor, as Dr. Richard says, all data, not only hospitalizations. We monitor the 7-day rolling average, which is currently 174. In the old days, the bad old days, if I could say, that was averaging 700, 800. We continue to monitor other parameters like our positivity rate, which is now 29%. In the days of the height of the Delta, that was 50% plus, I believe. We continue to monitor our rolling 7-day average in deaths, which is now 1. You would recall we had peaked on 1 day, which was in the 30s. We continue to monitor our ICU levels, which is now 11 ICU occupied out of 63, which is a rate of 17.4%. And just this morning, I asked for how many tests per day are we doing to give us an idea of what is going out there. So roughly on average, it will vary. We are doing about 418 tests per day. So we monitor every single parameter, inclusive of hospital rates. Where would this go? It depends on the population. It depends on is the population masking up in those high-risk indoor situations, vaccination levels. So we continue to monitor all these parameters on a daily basis. So thank you very much, Rashad.
Thank you very much, Minister, for a very comprehensive response to that question. We go now to azp.com for your questions. Good morning.
Thank you very much, Al. Good morning, Prayabi Hari, azpnews.com. Just to follow up a little bit on Rachel's question, is it that we are still seeing the people who are in hospital, are they still within that age group of 20 to 49? And are there any infants in hospital for COVID? And secondly, the 80% of the percentage that are not fully vaccinated. I know some time ago, I think it was around 90. Why do you think that is now 80%? Mm-hmm. Is it that, there may be some vaccine resistance to, in terms of the Omicron? Is that a factor? Thank you.
Okay. So let me try to answer your questions. The pediatric update, we have 2 pediatric cases in hospital as of this morning. So in terms of our pediatric question that you asked, in terms of the other demographic though, the people that we were seeing in hospital is not in the 20 to 49. I think that was the age group we had focused on in terms of vaccination. We are seeing, generally speaking, you would see people over the age of 50 or 60, especially those with comorbidities are the people that you would tend to see in hospital more often. And of course, 80% of those being unvaccinated. And even when you speak to the vaccination, even though people may be hospitalized and vaccinated in that 20%, you find that they don't escalate to need the higher levels of care, example ICU and HDU. Your second question, in terms of the dropping percentages, so we would have been in the 90s, and then of course over time we went down to the 80s, to 80, just over 80% in terms of the percent of those hospitalized that have been unvaccinated. So we find that basically over time it's a larger sample of people, one, so it's that period that we're stating, the 80, is actually over almost a year in the first instance. And then we also have a number of factors at play. One, the leading variant in Trinidad and in the world at this point is Omicron variant, and it has been shown to have an increased risk of evading the immune response, both naturally acquired and vaccine related. There has been, over time, there will be some waning immunity for those who have been vaccinated as well, and there's a lot of asymptomatic spread of this particular variant. So you find basically there's a larger proportion of spread that is flying that is going undetected, for example. So the number of cases would be, based on asymptomatic spread, will be larger as well. So, but the two main factors will be waning immunity over time, and of course that first factor where you have evasion of immunity by the Omicron variant of concern.
Thank you very much, CMO. We now go to the Newsday for your two questions. Good morning.
Good morning to the panel. This is Paula Linder from the Newsday. So my first two questions are for the minister, I think. The first one is that with the incubation period for monkeypox being 3 to 4 weeks, how has there been any discussion about how we plan to address this in a country where we have a sick leave of about 2 weeks, similar to what happened when COVID-19 landed? And the second question is, we've ordered 2,000 vaccines for approximately 1,000 people. Who would get these vaccines? Who would be first in line?
Yeah.
Thank you.
So the issue of sick leave is one to be dealt with by other agencies. We are responsible for the health response. On the issue of who will receive these vaccines, that is a very relevant question. So at this point in time, the vaccination program for monkeypox is radically different to what transpires for COVID or any other childhood disease where you want to vaccinate as much as your population to achieve herd immunity. With the monkeypox virus, we have ordered 2,000 doses. It's a 2-dose regime, which means you can vaccinate 1,000 persons. The Caribbean or the CARICOM region, I believe up to now, we don't have more than 10 or 15 cases as a region. In the CARICOM regions, you have countries with 1, 2, 3 cases. So those are the kind of numbers we are playing with. Right now, as we stand, the vaccination program will be for close contacts of a positive person. So if you have a positive person living in a household that's 5 persons, 1 or 2 colleagues, so let's go up to a maximum of 10 close contacts for a positive case. So we are having the ability to vaccinate 1,000 persons. 1,000 divided by 10 is how much? 100. So we are catering for roughly 100 cases. At this point in time, with the trajectory of monkeypox, at this point in time, the chances of Trinidad and Tobago registering 100 cases is relatively low. One of the reasons we could not order more vaccines at this point in time, and the door will always be open to order more as things evolve, are one, we have no idea of the expiry dates of the vaccines. You would recall when our first shipment of AstraZeneca came in, it was a 3-month expiry period, I believe. So we have no idea of the monkeypox vaccine expiry date. We also have no idea of price, as I indicated. But we have ordered enough vaccines to vaccinate a total of 1,000 persons and the priority will be given to close contacts of a positive person and any healthcare worker who wants to be vaccinated against the monkeypox virus. So those are the two populations we are looking at right now. As things evolve, as we get more surety, especially on expiry dates, we can order more if conditions demand. Okay? Thank you very much, Paula.
Thank you very much, Minister. We go to TV6 for your two questions. Good morning. Ms. Cutting, good morning. Okay, so we'll move on to azpnews.com for a follow-up question and get back to Ms. Cutting.
Thank you again. Morning. I just want to follow up CMO the pediatric cases. Can you give the ages of these cases?
So as is usual, we don't want to go into the granularity of it, especially in terms of patient confidentiality, and especially that we actually only have a few cases. So we never really disclosed the actual ages of these individuals in the past, and we continue to hold on that information due to patient confidentiality.
Thank you very much, CMO. We go back to Newsday for a follow-up question. Newsday?
Yes, good day again. So my next question is, have we, in preparing for monkeypox to arrive on our shores, have we put steps in place for testing passengers who come in from areas that are showing high incidences of monkeypox, for example, the US and Europe?
Okay, so Paula, don't think anywhere in the world tests passengers for monkeypox. What we do in airports and airports around the world is screening for temperature, which is an indication of a febrile disease. But nowhere in the world do you test an incoming passenger for monkeypox. And our airport thermal screening process is engaged at this point in time. I recently came back from Tobago over the weekend, and it is, for one, what I saw at both Piarco and Crown Point, they are working. I pay particular attention to these things. Okay, thank you.
Thank you. We go back to azpnews.com for a follow-up question.
Yes, thank you. Good morning again, Minister. In terms of decommissioning, I just want to find out what happens with the Couva Hospital. Is that going to remain fully a COVID hospital, or are we going to use it for other purposes at this point?
Thank you. So you may recall Cabinet took a decision maybe about 2 years ago to turn over the Couva Hospital to the University of the West Indies for their use as a teaching hospital for medical tourism and so on. In the interim, of course, COVID came. So we are currently using it as our premier tertiary level COVID facility. We have to wait and see the trajectory of the disease before we decommission it and hand it back over to the University of the West Indies.
Thank you very much, Minister. I'm wondering if Renessa Cutting from TV6. Oh, I'm seeing a follow-up question by Newsday.
Hello?
Oh, okay, so we'll go to Renessa. We're hearing you now. Ms. Cutting? Okay, so Ms. Cutting, you can WhatsApp the question. There seems to be some technical difficulties on your side. So we will take Newsday for now and then try and get back to you. But you can WhatsApp the question and we'll take it. Thank you so much. Newsday?
Good morning again. This is a non-COVID question, possibly COVID, but so I was informed today that the Chemistry, Food and Drug Division has been closed since the beginning of the pandemic. And recently renovations began on the building, which had been condemned by OSHA. So I wanted to find out where the testing of our vaccines and drugs had been taking place, because I know that it was. So was it in a separate building? Was it sent to CAFA or TPHL? Could you?
Okay, so Paula, Trinidad and Tobago, over the years, the drug registration process, as the CMO has explained several times, is one based on reliance of dossiers from stringent authorities like the FDA, European medicine agencies. No country in the Caribbean duplicates the testing of drugs. It's a very expensive process. It requires lab capacity that individual CARICOM countries don't have. Where drugs need to be tested, CAFA has their campus in Jamaica, as we have explained. CAFA has 3 Caribbean campuses, one in Trinidad for infectious diseases where all samples from CARICOM come to us. There's another campus in St. Lucia, I believe, for other issues like water safety, water standards, where everything goes there. And the Jamaican campus is the regional hub for drug testing. So any drug that any CARICOM country has to get tested, they are sent to CAFA Jamaica. We also rely, as we have always done, on testing capacity at UE and other stringent laboratory facilities in Trinidad. Chemistry, food and drugs, and this is a misconception stretching back decades, does not engage in individual testing of drugs. I would probably ask the CMO to explain how dossiers are read and so on again, so we could hopefully put to rest this issue.
So basically, in the registration process, the dossiers, which are technical documents that come to the Drug Advisory Committee to make a recommendation to the Honourable Minister as to if this drug or product should be registered in Trinidad and Tobago. No part in terms of the legislation speaks to the necessity of testing. However, over the maybe decades ago, there would have been some testing of certain products. Over the years, as Minister said, reliance on stringent authorities have been the main focus of the Ministry of Health. So we have gone towards more reliance than before. As I said, the document, what we are looking for in terms of testing is to ensure that the medication that are coming in is the same as that is stated on the product. So all the parameters are the same. And what is important to note as well is that when we import a product from a stringent authority, we also ensure that that product is being used in that jurisdiction as well, as a gauge to see if it is safe and effective for our people, based on our reliance principles. So more or less, Minister had covered most of it in his discussion, but that's just to add a little bit on the actual role of the Drug Advisory Committee.
Thank you very much, CMO. That seems to be all the questions that we may have for this morning, and we would like to thank the media for the very engaging questions, our panelists for their responses, and you, our viewing and listening public, for tuning in to this update. In closing, we ask that you please continue to protect yourself and your loved ones. And for up-to-date and reliable information on COVID-19, please go to the Ministry of Health's website at health.gov.tt or visit our social media pages. And if you haven't received your COVID-19 vaccination as yet, please get yours now. We also encourage you to make a habit of health practices that reduce the spread of the virus, and continue to wash your hands often, clean and sanitize frequently used surfaces, and we also encourage you to mask up in situations where you may be at a risk, such as on a flight, when taking public transport, at parties, celebrations, at places of worship, and even while shopping. And that's all for now. Thank you very much for tuning in. Be safe, and goodbye for now.
In the ring on the left in the blue corner, we have flu, short for influenza. On the right, in the red corner, we have COVID-19. Who will be the most terrible? Let's compare